Blood pressure. What is blood pressure? And what is high blood pressure? And what are the systolic and what are the diastolic blood pressures? What are the causes, symptoms, and dangers of high blood pressure? If this topic interests you, let us explore it together. Welcome back again with Dr. Magid in our channel Medicine Simply. We welcome you all and we hope that you get some benefits from our medical education. Straight to the point, what's exactly high blood pressure? It's a very broad topic and one of the most important in medicine, requiring more than one episode, of course. In this episode, we'll try to explain to you what blood pressure is, why it is considered a disease, and whether high or low blood pressure can be a disease. The truth is, we need to understand the definition of a disease. Blood pressure is the force of blood pushing against the walls of the blood vessels. And this is not a disease. So blood pressure, every person, every human has blood pressure. Blood pressure is simply the force of your blood pushing against the wall of your blood vessels. But high blood pressure, which is hypertension, means this force is too strong or too long, which make the heart and the arteries work harder and can damage them over time and can be dangerous. The problem is it is somewhat silent, not showing many symptoms. But we have to know that there's two factors which are responding to this blood pressure. The first is the amount of the blood that heart pumps, and the second is the resistance of your arteries. If we have to calculate the amount of the blood the heart pumps and the resistance of the arteries to the force of the blood flow, this can make for us the measurement of blood pressure. Imagine, as you can see in the picture, that the heart pumps and the arteries moved forward. So what is the deal with the high and low? The high, which is usually or normal, is 120, as you know, and the low, which is normally 80. The truth is that tissues and organs need blood for oxygen, and the function of the blood to carry oxygen and food, nutrition to the all vessels of the body. That's why the heart is pumping. So the heart's function is to deliver blood to the organs, reaching all body cells. It's like a motor, that pumps blood through the arteries. When the heart pumps, or as we say, contracts, that's the higher one, which is normally 120. To make it easy, we call it in medicine the systolic blood pressure. And the lower one, when the blood flows through the arteries, relax, with the heart relax, in the point when the heart not pumping. So the blood is still, but will not go back. So the wall keep it, which is the low measurement, which you know as mostly 80, the down one, or we call it in medicine diastolic blood pressure. Because at this point, the heart is still under a bit of pressure. So the first measurement when the heart pumps, and the second measure when the heart relaxes. We have two types of high blood pressure. One of them is essential and primary. And the main cause of this one is till now unknown. But there is some factors, like genetic factor, and a secondary one, which there are some causes. In both cases, there are contributing factors, which we'll learn about now, and some risk factors. For example, number one is genetics. If your father, mother, grandfather, grandmother, your auntie has or had many blood pressure problems, then you must try to measure and to check your blood pressure regularly. Maybe you have it and you don't know. Number two, the age. As the arteries become older. So this make us some warning that the age can affect the wall of the blood vessels. Can some tears happen in the arteries, losing the resistance, leading to death problems. Also, pregnant women is also at risk. Why? Because when she is pregnant, the baby pressing little bit on the wall of some vessels passing around. So we have mostly by pregnant woman little bit elevation of the blood pressure, even if she's not suffering in the normal time before or after pregnancy. Obesity is a major cause of high blood pressure because of high cholesterol, and cholesterol builds up in the arteries, so make the arteries rigid. Also, alcohol consumptions, smoking can also affect the wall of the blood vessels. And the psychological stress. A psychological stress making more stress, making more pressure on the wall. It is called also, if I have pressure in the work, you can have also high blood pressure. Also, unhealthy diet, especially if you have high salt. This playing a big role. Why? Salts absorb water, causing retain of water, thus concentrated the blood in the arteries. When the blood is concentrated, the pressure increased compared when it is diluted, allowing for smoothing of blood flow. There is also other factors. One of them is very important. It's diabetes mellitus, especially type 2. Mostly the patient of diabetes mellitus has high blood pressure. Also, thyroid disorders, some kidney diseases, and a very important point is sedentary lifestyle. This lifestyle, what we are living now, sitting in front of computer, in front of TV, sitting in our work. Our grandfathers has not this. When the body is stagnant with no movement and no activity, this common to make high blood pressure. Because when you move, the pressure become less on the wall of the arteries. That's why I advise you to walk half an hour a day. It's very important to make your blood fresh and your body fresh. Also, excessive sugar intake is a significant factor or a risk factor. You ask why? Sugar also? Yes, sugar making something like metabolic syndrome, which is a condition when you eat sugar, your blood sugar rises, causing a sugar in insulin production until your body develop insulin resistance. This is why there is a strong link between high blood pressure and diabetes. And we had another episode, we did it about food which is good for diabetes and food which are bad for diabetes and also for pre-diabetic. If you don't see it, you can see the link at the end of this video or in our info. When insulin resistance develops, blood vessels become damaged because sugar increases inflammation. When inflammation increases, the body releases more cholesterol, so it has to eliminate excess cholesterol. When cholesterol become more, it builds up inside the walls of the blood vessels, making the arteries harden and become the patient, we call it atherosclerotic, which the arteries are very hard, and this one of the most important causes of high blood pressure. Now we shift to the symptoms, which someone has high blood pressure and he don't know. So we mention it in an easy way. Number one is headache, especially in the front of the head, which is often mistaken as other causes of headache. If you have headache often, you have to measure your blood pressure regularly. Also, shortness of breath, especially when walking, running, doing some sport activities, or climbing stairs, and you feel little bit shorting of your breath, tightening of your stomach. This can be because of high blood pressure. Also, bleeding especially from the nose and from other parts from the body. If you have nasal bleeding, you have to measure your blood pressure. And also you can have this bleeding in urine, bleeding from stool, and this can be indication that you have high blood pressure. And some patients will discover suddenly when they bleed that they have very high blood pressure because the pipes, the arteries like pipes, these pipes will burst, which is more dangerous. So now the important question, which is more dangerous? The high one, the systolic, or the low one, the diastolic? Actually, both. But we are, as a doctor, on fear more from the lower one because this occurs when the heart relaxes, as I explained. So if there is something wrong with the arteries, we analyze the cholesterol in the lab and make sure that there are no problems when the doctor finds that the blood pressure, the lower one. So I think that we answered a lot of questions in this episode. Of course, as I told you at the beginning, blood pressure is a big subject in medicine, and we'll make more and more episodes about treatment, about food, what you eat when you have high blood pressure, what your advice is, how to manage high blood pressure, how to manage low blood pressure, and a lot of other videos. Thank you for joining us in our channel. Was with you, Dr. Magid, Medicine Simply. Thank you.